Our guest on this episode is a public health professional who is passionate about serving and supporting the Latinx community. She was a guest on this podcast back in episode 178 and returns to share updates and more of her journey with us on this episode today. You're listening to the PHEC podcast, episode 350. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. Whether this is your first time tuning in, welcome if you are, or you're a regular listener to the podcast, also welcome. I'm really excited and happy either way that you're here. I'll briefly introduce myself, or in some cases, reintroduce myself to you and tell you a little bit about what I do, and then I'll introduce our guest. I lead a public health epidemiology consulting firm that supports large nonprofit organizations and some government agencies that serve Black, Indigenous, and people of color community, which is commonly referred to as BIPOC communities. We are often invited to support tribal organizations, and we are always honored to serve. We help our clients communicate their data and health information in plain language to communities they serve. This type of support helps to build and strengthen relationships between the organizations and the individual community members. Some examples of the support that we provide, but not limited to this, includes comprehensive toolkits, fact sheets, custom reports, community health profiles, as well as data-driven workshop facilitation that engages community leaders on specific disease and health-related topics that are most pressing within that community. If your organization serves BIPOC communities or is genuinely interested in building relationships with BIPOC communities, then please reach out to us at our website, which is drchuntley.com. We'd be happy to meet with you and explore how we may be able to support your organization. The links to our website will also be provided in the show notes. Now, in this episode, my guest is Paulina Sosa, who was also our guest back in episode 178. Now, given that this is episode 350, that was a very long time ago. It may feel like lifetimes ago, but we have so much to catch up on because so much has changed. Now, I do encourage you to listen to that episode as well, episode 178. Paulina shared some great career tips for students, graduates, and career professionals looking to make a shift. We will provide the quick links to that previous episode in the show notes for this episode to make it just really easy for you to connect with all the stuff that we talk about during the conversation and what I'm explaining to you right now. Now, let me formally introduce her to you, and then I'll connect our conversation. Paulina Sosa is the founder and CEO of Latinx Voces, a social enterprise aimed at celebrating, showcasing, and amplifying Latinx voices, stories, and cultures. She is also the founder and president of the health branch, the Latinx Task Force, which is a coalition of local, state, and national organizations and agencies focused on addressing health and economic disparities in Latinx communities during and beyond COVID-19. Paulina currently works as the CME coordinator for the Smithsonian CME program under Access Smithsonian, which is a program focused on using art to engage with Alzheimer's and dementia patients and their caregivers. Paulina has worked for more than 15 years in public health, including advocacy, data analytics, and communications. Her work has revolved around infectious disease transmission and epidemic and pandemic preparedness, including influenza and COVID-19. Paulina is currently a doctoral candidate in the Doctor of Public Health Informatics program at Johns Hopkins University. She has worked at the World Health Organization and at the Pan American Health Organization as the lead data analyst on influenza. She has also worked with the American Journal of Public Health, the American Public Health Association COVID-19 response team, and during the COVID-19 pandemic provided consulting services for PHEC and other partners in data surveillance and public health communications. Let's connect my conversation with Paulina right now. Thank you for joining me today. I'm excited to chat with a sweet friend of mine that was a guest on the podcast back in 2021. We looked it up just a few minutes ago before starting to record. Paulina, how are you? And welcome back to the podcast.
Hi, Dr. Huntley. It's so good to see you. It's been years, really, since we've last seen each other and really dived in. So it's great to be here and great to be able to share a little bit of the work we've done over the last few years, especially now that we're post-COVID.
Yes. I'm really excited because it's like we blinked and all this time passed. It really hit me once I looked up the date and realized, it's been a minute. So let's start this conversation like I like to start all of them, is just kind of talk about the journey to where you are now. And then we'll spend some time digging into what you're doing now. So my favorite question to ask on the episodes is, when did you first learn about public health or first become interested in public health?
Oh, yes, that's a great question. I feel like the answer to that is probably a little bit long-winded, but for the purposes of today, I'll go ahead and share just kind of a synopsis. So back in college, actually, or even before college, I was working with the One campaign. I'm not sure if everyone's familiar, but the One campaign is focused on fighting and ending extreme poverty around the world. And so that was my first real foot in the door into public health and I didn't even realize at the time was public health. And as a Gates Millennium Scholar, I realized during my college days that public health was one of those sectors, one of those fields that the Gates Scholarship really promoted and really wanted students to dive into. And so I did a little bit of exploration into public health and into what the field really meant, and realized pretty quickly that public health is pretty much everything. And so with that new understanding, I decided, okay, let's dive in and let's get a master's in global health policy, which is really what I was focused on with the One campaign. And so in my years during the master's program, I feel like that's really where I got the kind of crux of what public health meant, not even just from a global health perspective, but just from a public health perspective domestically. And so I feel like that's kind of the quick story of how I got interested into public health and how I got into and really focused in the field of public health.
It's interesting how a lot of us discover it, as we're on our journey. And it was not necessarily for a lot of us. I know for myself, I knew what I wanted to do. I just didn't realize that public health was the name or the title for it. So finding that was like a perfect fit for me, even though it happened for me much later in my career than most people right now. So definitely understand, what you're saying there. Is there a particular population or public health issue or problem that you are most passionate about today?
Yeah, I feel like starting with the roots of my journey into public health, kind of like you said, I was doing public health for most of my life and didn't even realize it until I started the master's program. But it was actually in my practicum at WHO that I realized the power of data in informing policy. And at this point, fast forwarding to the work we do today, I talk to a lot of students and a lot of public health leaders and officials that are focused on public health policy. But I think with the experience that I had really focused on data and informatics, I realized the importance of data in informing health equity, in informing health policy, and informing the type of funding that's provided to organizations doing community health work. And so if I were to answer, I would probably say something around data and health equity. I think those two terms are very loaded terms, right? I think those really are more umbrella terms for the specific work that I do now, but also the specific kind of fields that we all focus on. But I think just from a very general standpoint, really understanding that data does inform health equity and vice versa, right? And so if there's inequities, and we saw this during the pandemic, if there are inequities that exist, that's going to also have an impact on the kind of data that is available to collect and the kind of data that is available for policymakers to use. And so I think we see that there's this inevitable cycle, right? And inequity feeds inequity and vice versa. Equity feeds equity. So how do we utilize data to further address and further implement health equity for communities that are vulnerable in this country? So that's probably kind of my short answer to, I feel, a very long question about my biggest passion in public health. But as we know, in public health, everything feeds into each other in public health.
Yeah, absolutely. And you don't have to feel any pressure to give us the short answer. I know my audience loves the details. We love the stories. So you don't have to, you don't have to worry about that. Well, I agree absolutely with, what you're saying about the inequities, about data, the information and importance, especially, through consulting the side of our business, I serve specifically BIPOC organizations or organizations that are really genuinely seeking to connect and serve BIPOC communities, because they're the ones that are the hardest hit first, suffer first, and the greatest. So everything that I can do to help communicate that data, that information, those numbers, help make sense of it, tell the story in a way that people can really understand. So my heart goes out to, it resonated with me when you started describing that importance. Tell us a little bit more. This is a perfect segue into what I wanted to ask you about next, because we have so much to catch up on from where you were back in 2021 to where you are now. So please tell me more about what you're doing now. We were starting to chat a little bit before the recording. I was like, wait a minute, let me not ask too many questions yet. So tell us what you do now, and then maybe we could kind of weave in some of the context of, how that's different from the last couple of years.
Sure. Well, I'll go ahead and answer by, I guess, kind of tying in my previous response about data and health equity. So really kind of understanding the importance of addressing health equity and addressing the needs of vulnerable populations leads me to the work that we do now with Latinx Voces and the health branch, the nonprofit branch, the Latinx Task Force. And as the name implies, Latinx, we focus primarily on the inequities and the disparities faced by Latino communities across the country, including Puerto Rico. And really what we've been able to do over the last, at this point, 4 years, right? We have, been able to specifically address needs in vaccine equity during the COVID pandemic, right? If we think back to the year 2021, we're right at the cusp. We're right at the height of this emergency pandemic. And the task force, along with the number of partners we have across the country, really came together to say, you know what, Latino health is being detrimentally affected. And yet, unfortunately, the voices at the table are much smaller than the proportion of the population that is Latino. And so we decided to be a voice for nuestra comunidad, for our community. So the task force collaborated with Health and Human Services in their Juntos y Podemos campaign. And many of us listening might remember that blue map, right? It was a blue map that said, we can do this. That was the kind of COVID education campaign on vaccines and what is a vaccine? Why is it important to get vaccinated? And so we're excited to say that we were able to collaborate on a national scale to do a 25 city tour. And we did it all the way from California to Florida to Puerto Rico. And it was definitely a big whirlwind of work and excitement and stories and just being there for the community, with the community, to learn from the community. And I think that one of the biggest takeaways for me personally, but also for us as an organization and for us as a network of partners, was really, really putting a face to the differences and the uniqueness of different Latino cultures and the diversity that is represented by the multitude of communities in the Latino population, right? And so me, a Tejana from South Texas, is going to feel very different in a Cuban community in Miami, right? It's a very different dialect, very different food, very different culture. And so across all 25 cities, we were able to really highlight that and showcase that and celebrate the uniqueness, but also kind of from that health perspective, provide information through the trusted leaders of those communities. And so really amping up the power of non-traditional partnerships in addressing the inequities in our community, right? So, of course, COVID emergency came to a close last year, but that doesn't mean that the inequities or the disparities have stopped magically, right? And so now what we're doing is we've launched, with the foundation of the best practices and lessons learned from this tour, we've launched an initiative called Luchar, which is an initiative focused on, again, those health priorities that are described and identified by the partners that are on the ground with families, and really identifying, one, what are those priorities? And two, what are the different solutions to address those priorities in a sustainable way moving forward post-COVID? And so one thing that I can say has not changed between now to 2021 is the fact that partners remain at the crux of the work we do. So building partners, building relationships, and really maintaining those relationships and continuing to be a support, but also a platform for the work that they do so they can also work together. And that's the beautiful thing about building a network like this and really building a trusted system, a trusted place for them to come together and to share. And so that's just a little bit into some of the exciting initiatives we've been working on and kind of bringing and tying together some of the importance of data addressing inequities. But there's really been just such a huge shift, I think, in the narrative that we're able to now share with communities on the outside, with allies, with public health leaders, with public health institutions. And so we're just excited to be there and to be at the table and to be able to share this is what's important for our community.
I love that. And this is all under the Latinx Task Force, the nonprofit.
Yes.
Right. So I love what you're saying. And it's so true, especially so much, everything you're saying. I love everything you're saying. But I was thinking about, as you're talking about the diversity and the uniqueness within the Latinx community and how there are all these nuances that are different. It's like a constant aha and eye-opening moment as I work with BIPOC communities. Because as a Black woman, we talk about this all the time, but just recently I was talking with my colleague about this. We're very different. I had a small group retreat, in-person retreat, and we had Black women there. We had one or maybe a couple in the different sectors, but I remember this specific conversation. So that we had Jamaican Americans, and we had Haitian Americans, and we had some Nigerian Americans, and we're just kind of chatting in the room. And somehow we got to the conversation about rum cake. Okay. So one of the women that was Haitian American said something about, oh, well, you just kind of put the ingredients together and mix some rum. And the Jamaican Americans were just like, offended, like, whoa, no way. You have to, certain ingredients, you have to soak in the rum. And so I say that to say it's such an eye opening. It's easy to think, oh, as a Black woman, I guess, what's happening to you is just kind of all the same for Black women, just like you could say, Latino, so it's very different. As we're sitting there listening, very different to hear the conversations about something as simple as, we're talking about rum cake, but just the cultural differences. And it's just really important. So we have to always remember that. And we meaning, representing, and really one of the reasons I'm so passionate about serving in this way is because to the organizations that I am partnering with and working with, some of them may not be aware of this level, or not really, maybe there's an awareness, but not knowing what to do or how to handle. But it's not that I can speak for all of us under this umbrella. It's just that it's this very point of there is so much diversity. It's a constant exploration. There's so much more to learn all the time. And like you said, celebrating differences. I absolutely love what you're doing there. I want to also ask you about the city tour. So a 25 city tour, how long did that take?
Oh, gosh. So because of the grant deliverables and timeline, we really were limited with time. We started it in, I guess you could say it was March of 2022, and we ended in May of 2023. So it took a little over a year with the holidays off for the most part. And so we did have about a 2-month break in between traveling, but it was definitely all hands on deck for that tour, making sure that we had everything we needed for the in-person side, but also for the virtual and the communication side, and just keeping up with all the stories that we were gathering. And actually, I'll make a reference here to the kind of specialization that Latinx Voces provided during the tour. Since Latinx Voces is more focused on the cultural aspect of the Latino community, so less so the public health side, and it's more so just culture, art, small business. And so what we were able to do during the tour was integrate the mission of Latinx Voces into some of the health work we were doing, and really taking an opportunity to stop in each city, really take in the culture of the Latino community we were meeting and serving, and have an opportunity to meet with artists and small business owners from that community. So outside of the vaccine clinics and meeting with the health department and doing this and that with our health partners, we had a chance to also just meet with the community. And just so powerful being able to hear from a small business owner on the barriers that they had to overcome to keep their business alive during COVID. And, again, bringing it all back to this sense of pride in our community and this sense of celebration of the work we do. And so even though it was about a year, it was one amazing year that we were able to just dive in all the way in to learn about the community, about the city, about the culture, about the dialect, and just appreciate it and be there to hear and to listen to the stories, the different stories that came from the community. So, but it was an exciting year nonetheless. And like I said, a lot of work and a lot of really well spent work and time with people, but also just such an amazing eye-opening opportunity for those of us that were able to do the traveling in person.
Yeah. Oh, I would love something like that. I can appreciate the effort because we did a lot of workshops around the country. I did a little bit of international travel for that. We didn't have a 25 city tour by any means, but with the heavy travel schedule, I can just imagine. I know what goes into planning any sort of in-person event and then to do this over multiple cities. I'm happy that you were able to do that. It's such a rich experience. I can imagine what that would be like. And you also have my mind thinking like, maybe we should plan something like this.
Oh, we're always here to provide more information or support. So let us know.
Yeah. This is reminding me too of when we met before for the interview back in 2021, Latinx Voices, you were describing that art, bringing that creativity into this public health space and the expression and the connection through art. And I'm really excited to hear how you're able to really integrate that. So for everyone listening who may be a little confused right now, because we're talking about kind of two different businesses, let's just clarify that for sure. You have an LLC, which is Latinx Voices, and then you have Latinx Task Force, which is a nonprofit, correct?
Yes, that is correct. One is focused on health, the task force, and then Voces is focused on the arts, culture, history aspect of the community.
Okay. Well, tell me, because I know most of what we talked about was around the task force. So let's take a minute and talk a little bit more about this art and connective, this culture, and we know all that you do with Latinx Voices. So tell me a little bit more about that.
Sure, sure. So inevitably, Latinx Voces does collaborate a lot with the task force, considering just the national scope of the health work that we do in the task force. But Voces also has its own network of partners. And so Voces really highlights the importance of artists in our communities, small business owners, and even historians or, cultural festivals that happen across the country. And, I think a good example of that is I'll make a little shout out here to one of our author partners, Edward Dennis. And he's an author that he's actually getting ready to push out his second children's book focused on really just a Latino story, a Latino immigrant story. And just such a powerful example of how an author can really highlight, one, important issues in our community, but two, also giving children an opportunity to see someone who looks like them in a space like authorship. So he's a good example of just one of those partners that we work with to, one, support and showcase their work, but two, to also collaborate with them. And so we're hoping to actually do a few things with him during Hispanic Heritage Month. And we try to do the same thing for other authors, artists, small business owners to, again, really bring back the focus of celebrating our community and celebrating how different artists and small business owners really are inspired by their culture and have integrated their culture into the work that they do, the passions that they have. And so it's really been exciting being able to integrate some of that Latinx Voces mission of celebrating and amplifying Latino communities in the work we've done with the task force. And actually, I'll make a side note here as well to say that this is part of what we mean by non-traditional partnerships. And I think inevitably public health, as we say, is everything. We're talking about everything. But I think there's been a history in public health of partnering with health-specific organizations, health departments, different organizations that have that public health nuance to it. When COVID hit, we realized, I think as a country or even as a world, we realized the importance of collaborating with non-traditional partners, including your small business owners and artists and restaurant owners. And how can we bring together all of our expertise to support and help the community together? And so I just want to make that side note as well, because Voces really having that cultural focus, I think, has been able to really help with some of the health aspect partnerships that we've been wanting to make. And then one other thing I'll share with Voces is that we also have been really excited to start providing technical and workshop services to different partners depending on their needs. And so that's kind of one of the differences, aside from the community aspect, just, being able to provide technical support or consultations to different associations and organizations to ensure that they have the tools that they need to do the work that they do in their community. And so serving as a support system in a different angle than the task force. And so, but all in all, we kind of come together to ensure that we can provide one holistic service for everyone that comes to us.
Love that. Thank you for taking some time and breaking that down and really explaining that, because I want to make sure I don't get too selfish and just get caught up in just our conversation. But I want to make sure my audience and my listeners that maybe weren't around back in 2021 listening to us are getting to know you and hearing this. And it does make my heart very happy because I'm remembering a lot of little details. During that time back in 2021, you also were on our panel with the Public Health Consulting and Entrepreneurship Expo. And you were, really looking to find the structure and what you were going to do and the direction. And it's just really nice to hear you, a few years fast forward to the strong foundation that you have and the clarity for both directions that you are, serving in through the LLC as well as through the nonprofit, and the impact is tremendous. So it's not that I didn't believe, of course it doesn't shock me that you're doing these things. I'm just excited to see your growth and be part of, oh my gosh, it's nice to see this flower kind of unfolding and how you're able to reach so many people. To do a tour of this magnitude and to be able to operate these two businesses definitely represents huge impacts in community. So kudos to you. Definitely.
Couldn't do it without our team. We're a small but mighty team. And I have to say that we're blessed. We're blessed. So I got to definitely give credit where credit's due to our team. And of course, with God's guidance in our work as well. So this is very much an answered prayer for me in many ways.
Yeah. That's wonderful. That's wonderful. Very inspiring. So I appreciate you sharing that. Let's pivot a little bit. We've talked quite a bit about a lot of different things, which I absolutely love. And I want to be cognizant of your time. But I would also like to just take a moment and do a little connecting the dots. I think it's really nice when, especially because the listeners of our podcast are very diverse. We've got people on all levels of the career path, educational journey, different levels of understanding. People are now listening to the podcast who are not in public health, like talk about non-traditional partners. People find this podcast as a way to understand public health. It's very relatable and conversational here. So I like connecting the dots because of that. We don't want to just kind of make people connect it all together and make assumptions. But so with this next question, I think it'll help really tie it together quite nicely. So how has the understanding of public health helped you better serve your communities and have a greater impact?
For me, I think having that understanding in public health has really given me the foundation in many ways to really launch an organization, a nonprofit like the Latinx Task Force. And the work that we do, even though many of the partners we work with are your non-traditional partners, we also do work with a lot of your traditional partners, right? And so just making a reference to colleagues that we have at the CDC or at HHS, or working with researchers from academic institutions like Johns Hopkins or UT Health. And of course, working with your health organizations, your CBOs, but also your community-based organizations, but also your associations like the American Medical Association. And so having the understanding, just kind of your foundational understanding in public health, is what gives us in many ways the credibility to do what we do and to understand the different systems within which we work. Understanding that health equity is much more than just having access to a vaccine clinic, right? Health equity is also about having access to different social determinants of health, right? And understanding what that means, or understanding the initiatives like Public Health 3.0 and Public Health Forward or Healthy People 2030, right? All of these initiatives have a basis in public health. And so I think for me, with my educational background in both public health policy, but also in just public health informatics, public health data, understanding the system of public health in which we work here in the country, but also globally speaking, I think is what really lends its credibility to the work and the expertise that we offer, as well as the expertise that we request from partners, and, really understanding how best to ask those questions. So all of it plays a role, right? We also have a team that many of which do have public health experience, but I think knowing that even our non-public health team members, their expertise are just as critical, right? So having an expertise in technical or computer software programming is just as critical for the work we do. So I think all of the experience that I've been able to bring forward in the work we do in the task force has helped tremendously. But I also want to really give credit to the other expertise we have in the group. And so we have a mix. And I think all of that kind of comes together to building a really holistic foundation for the work we can offer.
Nice. Yes, nothing like having a good team for sure. Okay, one final question, and then I will let you go. again, our audience is diverse, but maybe there's someone listening, and I imagine that there are several people listening very inspired to hear from you in your career journey and the things that you're doing, you've been able to accomplish. What's one bit of advice or tip that you have for someone who's listening and also feeling inspired to want to do something and have impact on their community?
I love this question. So I think for those that are listening, I'll kind of put this in two different parts. For those that are listening that are in the public health path, first, just want to say kudos to you, right? Figuring out that public health is the field you want to be in. I think for many of us, right, it took a long time to figure it out, and maybe it did for you as well. But kudos for you for being part of this field and for really wanting to dedicate your time and experience to fields of public health. I think my one piece of advice, if I could dwindle it down to just one, would be to think out of the box. And when I say that, I think in many ways, COVID shattered the box, the cookie cutter box that many of us are used to in public health. And now that you're kind of in the post-COVID realm of public health, I think now is the perfect opportunity for you to bring together your resources, your expertise, and whatever your expertise is, to thinking about something creatively and thinking about something out of the box. And I think many times using our own personal experience, whatever that may be, really helps make that happen. And so as you're looking for internships or you're looking for opportunities of employment, first, of course, feel free to reach out to us. We're always happy to talk and see how we can integrate your ideas into the work we do. But also, don't be afraid to kind of go out of the mold a little bit. So I would say that would be my first piece of advice to those that are on the public health path. And for those that are not on the public health path right now, but have an interest in public health or an interest in collaborating with public health, just as much as, the public health person, we want to say kudos to you for your interest in this field and your interest in collaborating with us. And again, there's a reason why at Latinx, we really highlight the importance of non-traditional partners, right? And so whether your expertise is in computer engineering or it's in writing or it's in design, whatever it may be, it's all critically important to supporting the work of our community, right? And I think that there's something to be said about coming together with other students or other organizations that may just be a tad bit out of your scope of work, but really thinking about how your expertise can further the work that organization does in the community. And so I think at the end of the day, what I'm trying to say to all students or, all professionals that are listening to this podcast is think out of the box, think creatively. And, of course, we can always be called upon to be a source or a resource for you in your journey. But just so excited to see and to hear more about the work that everyone that's listening to this call is doing. And, just grateful to be able to share a little bit about my experience as well.
Wow. Well, thank you so much. Excellent advice. And I love the way you break it down and really help people see where they can fit in and where they can connect and celebrating their decision and thought process. That was really, really good. So thank you for that. And thank you for just being with us today and sharing about this update for the listeners that remember that episode. Now, some people are going to go back and listen to episode 178 was the previous episode, just to help you, let you know. And we will provide the link in the show notes for this one, just to make it a little easier so you don't have to really go searching. And we'll also provide links to connecting with Paulina as well in the show notes. So I'll tell you about all that in just a moment. But Paulina, thank you for being here. Keep doing what you're doing. I cheer you on. Huge fan and such needed work. So I appreciate you.
Thank you so much, Dr. Huntley. It's been such a pleasure to catch up and again, just appreciate the platform to share more about what we're doing. So we're excited to definitely stay in touch and see how we can continue to collaborate together.
I really hope you enjoyed that conversation as much as we did. It was nice to catch up on things and see how much has changed over the years. Paulina is a community leader and an inspiring public health professional. I encourage you to connect with her and learn more about the work that she's doing. You can find the links to connect with her by visiting the show notes page for this episode. Now, this episode is episode 350. Just visit phecpodcast.com. And once you're there, navigate to episode 350, and that's where you'll find the show notes. One more thing before we go. Do you know of anyone, student or career professional, who would be interested in learning about the creative and diverse ways that people are leading and serving in public health? Please take a moment and share this episode with them. I'm sure they would be interested in hearing this conversation, the one that you just listened to on this episode. If you're listening right now in one of the podcast apps, then you can easily share this episode right through a text or directly to social media. At the bottom of the show notes page, you'll also find social media sharing buttons, which make it super easy to share this episode with your network. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.